either need it adjusted or you don't. And if you get a manipulation when you don't need it, you're asking for some of the most severe problems that you could ever see in your entire life. So we developed a new instrument in 1963. And I had a patient who came to me when he was 35 years old. And he had been everywhere. No one could help his lower back. And with the stuff that Thompson and myself had put together, we straightened his lower back out. And for years, I used his post-X-ray as the X-ray to show you what the perfect spine should look like. And for 20 years, I talked this man into maintenance chiropractic care, telling him that if you listen to me, you will always be healthy. Now, this man was only 5 years younger than me. So for 20 years, he listened to me, and he'd come into my office every Tuesday morning, and I'd take a reading. And I'd have a reading on his spine that would look something like this. I'd have 2 bumps. And I would adjust the atlas vertebra and take away 1 bump. The next time in, the 2 bumps would be back. And I would adjust the axis vertebra, and I'd take away 1 bump. Probably 2 minutes after the adjustment, the readings were probably back. Since I was only seeing him once a week, I didn't know that. And since his lower back was doing so great, I just ignored the fact that I could not break this man's pattern. I pounded his atlas probably 1,600 times, and his axis probably 750. Now, if a man with arms like that could move an atlas vertebra, which weighs about how much, Burl? 3 ounces. Burl is the scientist in the group. If an arm like that could move an atlas in 1,650 times, then I think it's time to try to find something new. But anyhow, on October 19th, 1978, after 20 years of this wonderful maintenance chiropractic care, this man took a paralytic stroke at the age of 53. And then I thought, this is really something, isn't it? All your lies. I wanted to get out of chiropractic because I knew that all of my successes were mostly lucky. Everyone has to get lucky occasionally. But I knew one thing for sure. I was not practicing with a rhyme or a reason. I figured it was time to change my life. On January 19th, this guy come out of the hospital, this big, healthy, high-wire climbing man with a crutch and a cane, could hardly walk, and he drug himself back into the same guy that could prevent it and asked me if I could correct it. I went to the window, and I started crying. I thought, what an idiot to think a man who promised him hell and could prevent it could correct something he couldn't prevent. What am I going to do with this man? Am I going to pound his atlas again? Am I going to pound his axis again? Or should I look to that reverse curve that this man's had for 20 years, that everyone told me that that was one of those things? So I decided I'm going to give this man a different adjustment. I'm going to lay him face down, and I'm going to pick the vertebra that's farther side of the line, and I'm going to wrap it a good way. And I said to him, I'm about to do something to you that I have never done in my entire life. I don't know what's going to happen. He said, Doctor, you think it could kill me? I said, yes. Yes, I think it could. I said, but I'll let you die anyhow, so really, what makes the difference? And he said, you're right. Then I talked to the man behind me, and I say, how hard should I hit this? And this thing inside me says, hit him as hard as you possibly know how. Are you sure? Yes, but wonder if I kill him. Well, you left him die anyhow, so go ahead. So I said, okay. And I wrapped him a good one. And when I wrapped him, if you ever read my results book, it'll say I dropped down on my knees to talk to him. I wanted to hear him call me a dirty name. I wanted to see if he could still breathe. And I said, how was that, Larry? He said, pardon the word, people, manure, that that was nothing. He said, you hit me harder than that many times over on that table. Now, why could I hit him hard over here? Because everyone told me it was okay. So he said, well, I'll tell you one thing, Doc. My arm that's been paining me for 3 months, the pain is absolutely gone. I said, you're kidding me. He said, no, it is absolutely gone. So, that's wonderful. And I got him up off the table, and for the first time with any adjustment, I had totally cleared this man's readings on the instrument. For the very first time. Within 10 days, this man was lifting a bag of sand with that paralyzed hand. And the rest of it is history. Then I started looking at all the problem cases that I had pounded years after years after years, and I found a common denominator. Every one of them had a reverse curve or thereabouts, including my own beautiful wife had a neck of what I considered a minus 30. After 35 years of chiropractic care, the finest techniques you can think of. Galen Price, a man that I love more than I love anyone in this world. Virgil Stratton, John Grosti's head man. Clarence Gonstead's man. Ian Toughness's man. Just about anyone you knew had a crack at that neck, and that's what it looked like. Only, instead of having constipation and period cramps, now she had a blood pressure of 266 over 166. See? So don't pretend that taking away symptoms means correction. And that's where most chiropractors live, with the taking away of symptoms. That's not correction. Most people practice chiropractic just like medicine is. They help people die a little bit more comfortably. See? So I compiled records on all my failures for 3 solid months. Pre and post x-rays that were unbelievable for people who could see. There's a lot of people in our profession that can't see. Okay? And I took these records to Palmer College. I went before an evaluation committee to show what I was doing. There were 7 people on the evaluation committee. 3 of them was my friends. 4 of them didn't know me. The vote was 4-3. You can't put a technique like that into the profession. Someone might get hurt. Absolutely, they'll get hurt. If you do like one boy did here at Sherman College, he hit a girl on the back of the neck with what he said was an adjustment. And she got in severe problems. Her name is Susan Lerner. And she was in severe problems for a year from the bang he gave on the back of her neck. But then she came to see in Michigan to see me. And she said, somebody who uses your technique hurt me. I said, wait a minute. I don't take credit for anyone that uses what they call my technique because I don't have a technique. I have a system of adjusting the segments of the spinal column. And I went out and I told people about it, and they don't use instrumentation. They just bang away without proper authority, and they do the hurt. I checked her. I said, if you want me to adjust you, I have to adjust your fifth cervical. Oh my God. Well, I adjusted her fifth cervical. And when she got up off the table, she said, is that a fifth cervical adjustment? That isn't what I had. I said, I know it wasn't. You had a bang on the back of the neck. I said, there is a definite difference. Today, Susan and John Lerner are both practicing with a spinal visualizer, with adjusting instruments, 230 tables, and pattern me as much as they can. They have a nice little baby girl. They have a very successful practice. Because I turned her life back around with the same thing that people thought had destroyed her. But this is where condemnation without investigation comes. When I started teaching the fifth cervical work, not because I wanted to, but because Palmer College wanted,